There's a silent epidemic in America: sugar toxicity. In this video, Dr. Edwards explains in detail and demonstrates the toxic effect of sugars on our bodies and what we can do to lessen and reverse that damage. This lecture was presented by David A. Edwards, MD, HMD, and Jean Malik, MBBS, APH, to the Nevada Homeopathic and Integrative Medical Association in October of 2015. For many, this lecture will bring back memories of your college biochemistry classes.
Now back to blood sugar. One of the problems we're having today with the medical establishment is they keep looking at the height of the blood sugar. And now you're back to definition. If the blood sugar goes to this point, it's not diabetes. If it goes to this point, it is. It's just all by definition. A lot of metabolic syndrome patients, it's not about how high their blood sugar goes. It's about how long the sugar stays in the blood. It's scientifically referred to as impaired glucose disposal. So when you look at blood sugar, it's not an accurate measurement. That's why you want to look at the hemoglobin A1C. That'll tell you if there's impaired disposal, because you'll see the glycation of the red cell protein. So keep in mind when you're looking at sugar, you not only want to pay attention to how high it goes, you want to pay attention to impaired disposal, which of course blood sugar, unless you do glucose tolerance testing or something like that, it can't tell you that's impaired disposal. The reason that's important is because a lot of folks use glycemic index diets. And if you understand glycation, you can have glycation of tissue with a normal blood sugar level. So a low glycemic index diet, and I'll show you an example of that in a few minutes, may not stop or slow the process. This is a chart, and there's several different variations of this. It just shows you what a hemoglobin A1C is compared to the blood sugar. So when the lab tells you hemoglobin A1C is of 5.5 is normal, their estimated fasting blood sugar is 111. Most experts today say it shouldn't be above 85. And therein lies the problem, because it's a continuum. If you have sugar, it's going to glycate. Whether it's 70, 50, it's still going to glycate. It might occur slower. So there is no lower safe limit of sugar. It's why you can't live forever. You're designed to die. You get rusting from free radicals, and you get glycation of proteins from sugar. And of course, your hormones go awry, and your genes run amok, and that's it. This is a patient. This fellow, taking care of his kids, his mom, his dad, the whole 3 or 4 generation thing. He kind of got religion last year. He's 62 or 63, where he decided maybe he should do something about his health. I think something happened to one of his friends or something, and he's a pretty healthy guy. He exercises regularly, he's thin. He's a great patient because if you give him advice, he takes it. He doesn't just blow it off, he takes it. So he came to see me, and we went through a full exam. His vascular studies were normal, everything was good. And I believe this is April of 15. But what we found on him was his hemoglobin A1C was high. I think it's 5.8. His vitamin D was low, and vitamin D is a hormone. It's not a vitamin. Vitamin D is a hormone. It is not a vitamin. And one of the things vitamin D does is it regulates all other hormone receptors. It's a primitive hormone. That's why species like dogs, whales, porpoises, goats, it's the same chemical. It's all cholecalciferol. So it evolved very early in the evolution of life. But he was low vitamin D, and every once in a while I've seen folks with high hemoglobin A1Cs, we get their vitamin D level optimal, get it above 50, and the hemoglobin A1C will come down. Also, his C-reactive protein is high. So, the guy's healthy. Looking at him, and in conventional medical sense, he's healthy, but the C-reactive protein tells you he's got low-grade inflammation going on in the circulation, and he's got a sugar issue going on here. So I gave him his marching instructions, and one of the things he did was he grabbed a card out of our waiting area where he went to a local dietitian. And the tragedy here is I sat down with this dietitian 2 years ago and tried to explain to her that low glycemic index diets may not stop this process. Well, what she did was she put him on a low glycemic index diet. So he's happily following the diet, eating blueberries and fruit and stuff like that. 4 months later, his vitamin D is up to 48. His C-reactive protein actually went up. The inflammation actually increased. and his hemoglobin A1C didn't change. So he was a little annoyed because he said, I did everything she told me to do, and I believe this guy did everything he was supposed to do, and it didn't work. Because I said, the glycemic index is only looking at how high the blood sugar goes. It does not tell you about impaired glucose disposal. So following a low glycemic index diet may not help this condition of metabolic syndrome.